Hey everyone, Dr. Sorin here with Idaho Pain Clinic. So today I want to talk about MBBs. MBBs stand for medial branch blocks. Now the medial branch is a nerve that numbs up the facet joint, which is in your lower back. The facet joint is a very common source of lower back pain, especially as we get older because we get arthritis in those joints. And so the MBB is a test where we numb up that nerve and we see if that is the source of your pain. If it is, then we need to follow that up with what's called a radio frequency ablation, or an RFA, or another name is a rhizotomy. And then we see if that rhizotomy or that radio frequency ablation will get rid of your pain for longer term. But back to the MBB, that's a short-term test to see if that gets rid of your pain. So once you have the MBB, you need to fill out a pain diagram. So every half hour for about 6 to 8 hours, we want you to fill out what the level of your pain is. We take a pre-injection reading, and then every half hour you mark what your pain is. We want you to do some degree of activity that would normally hurt your back, but obviously nothing too out of the usual, because then you may end up hurting yourself while your back is numb. So if you do have some injection pain, because it is a number of injections, sometimes it can be as many as 6 or 8 injections, you can use some ice and Tylenol, or maybe even ibuprofen for the post-operative pain. Usually you get a follow-up within a week or 2. And I think my biggest takeaway is to help patients understand this is a temporary injection. And if this works, then we do the more long-lasting injection, which is called a radio frequency ablation. If you notice a lot of bleeding or fever, chills, anything like that, you would need to call the clinic, but those side effects are exceedingly rare. So I hope that helps.